discussing casts and traction. The purpose of a cast is to provide immobilization for an injury, support the limb above and below the fracture, to promote healing, and to prevent and decrease muscle contractions. To care for a cast, you're not going to want to submerge it in water. If you're going to take a shower or a bath, you would want to cover the cast in 2 layers of plastic or waterproof casing. You're going to elevate and apply ice if it is swollen around the area, and inspect the skin around the cast regularly. You'll also monitor for the 6 P's, which are pain, pallor, pulselessness, paresthesia, and paralysis. For a walking cast, you're going to, it's the same thing, except you're not going to want to walk on it until it is dry and hardened. So also, if there's an itch in a cast, you're not going to want to stick anything down there. You can use a hairdryer instead to blow on the area, and that will get the itch for you. You'll avoid dirt. You're not going to pull the padding on the cast, and like I said, inspect the skin around it. Also, don't trim or cut the cast. Leave it at the length that the provider put it at. Traction is to stabilize fractured bone with weights and pulleys, and there are different types. There are cervical traction, skin traction, manual, and cervical. Cervical is done on the neck. It's painful and is done under anesthesia. It stretches the neck muscles and decreases and prevents muscle spasms. Provides immobilization for the fracture. There's like a harness and weights, and like I said, it's done under anesthesia. For skeletal traction, it's done on the femur and the thigh. There's usually pins, wires, or screws in the fractured bone, and there are weights attached at the end of the bed so they can pull on that fracture and kind of reposition it. Manual traction, it's done before the placement of a cast to help align it. Skin traction is stabilizing a bone before surgery. It's less invasive than skeletal traction. You apply splints and bandages or adhesive tape to the skin below the fracture. There are weights also fastened that pull on the fracture to help reposition, and the soft tissues need repaired.